The medication amlodipine has been shown to lower blood pressure in thousands of people. But is it right for you? Well, that's what we're going to talk about today, so stay tuned. I'm a doctor, and if you find this video helpful, please share it with someone who might benefit from it. And don't forget to subscribe because new videos are released every week. Thank you for doing that. It really helps out. Amlodipine belongs to a group of medications called calcium channel blockers. It's used to treat high blood pressure and angina. High blood pressure can lead to heart disease and stroke, which are leading causes of death in the US. Angina is chest pain caused by reduced blood flow to the heart muscle. So how does amlodipine work? Well, it works by relaxing the muscles in the walls of your arteries. This allows your arteries to widen, which lowers blood pressure and improves blood flow. For people with angina, this means that more oxygen-rich blood can flow to the heart muscle, which relieves chest pain. What are some of the possible side effects of taking amlodipine? Well, like all medications, it can cause side effects, but not everyone will experience them. Common side effects may include swelling of the feet or ankles, dizziness, headache, nausea, fatigue, or weakness. If any of these symptoms occur, they usually go away within a few days or a couple weeks. However, there are some serious side effects that can occur while taking amlodipine, including a rapid drop in blood pressure when you stand up too quickly, which can make you feel dizzy or cause you to faint, and a small increase in the risk of certain cancers. However, studies have shown that the benefits of amlodipine outweigh these risks in most cases. In general, amlodipine is considered safe for most people when taken in the recommended doses. However, there are some people who should not take this medication. These people include anyone who's had a heart attack in the past month, anyone who has severe kidney or liver problems, and women who are pregnant or breastfeeding, people who have low blood pressure, a condition called sick sinus syndrome, or a slow heart rate also should not take amlodipine. In addition to these groups, your doctor may recommend an alternative medication if you have other medical conditions or if you're retaking other medications, including supplements. This is because amlodipine can interact with other medications, which can change how they work. So before you start taking amlodipine, be sure to talk to your doctor about any medications or supplements that you're currently taking. So how should you take amlodipine? Well, amlodipine comes in tablet form and it's available under the brand names Norvasc and Amlodipine. The dose of amlodipine that you need will depend on the condition that you're taking it for. For most people with high blood pressure, the recommended dose is 5 milligrams once per day. However, your doctor may increase your dose to 10 milligrams once per day if needed. For people with angina, the dose may vary depending on the severity of your symptoms, so your doctor will determine the best dose for you. It's important to note that amlodipine is a long-acting medication, which means that it stays in your body for several hours. This is why it's important to take your dose at the same time each day. That way you'll be sure that you're getting the full benefit of the medication. Also, don't cut, split, or chew on amlodipine tablets, since this can reduce the effectiveness of the medication. And finally, if you miss a dose of amlodipine, just skip the missed dose and continue with your regular dosing schedule. Don't take a double dose to make up for a missed one. Now, is there anything that can make amlodipine less effective? Yes, there is. Grapefruit and grapefruit juice can slow the breakdown of amlodipine in your body, which can lead to side effects such as dizziness or low blood pressure. So if you're taking amlodipine, you should avoid grapefruit and grapefruit juice. Now let's answer the question, is amlodipine better than other blood pressure medications? Well, it may be for some people, but it's not necessarily better overall. It just works differently than other medications. Like we discussed earlier, amlodipine is a calcium channel blocker, which means that it works by relaxing the muscles in the walls of your arteries. Other blood pressure medications work in different ways. For example, diuretics help your body get rid of extra salt and water, which reduces plasma volume and lowers blood pressure. ACE inhibitors and angiotensin receptor blockers, or ARB, relax your blood vessels and make it easier for your heart to pump blood. Beta blockers slow your heart rate and reduce the force of contractions of your heart, which decreases the workload of your heart and lowers blood pressure. So which blood pressure medication is right for you will depend on a number of factors, including your individual health conditions, other medications you're taking, and your lifestyle. That's why it's so important to work with your doctor to find the right medication for you. Now, let's talk about how long it takes for amlodipine to lower your blood pressure. It generally takes about 4 to 6 weeks for amlodipine to reach its full effect in lowering blood pressure. However, some people may see results sooner. Your doctor will likely check your blood pressure regularly when you first start taking amlodipine to see how well it is working. So if you're concerned about how long it's going to take to see results, be sure to talk to your doctor. They may also consider adding other blood pressure medications to your regimen if amlodipine alone is effectively lowering your blood pressure. There are a lot of things you can do to help lower your blood pressure, including eating a healthy diet, getting regular exercise, and managing stress. Let's dive into that a little bit deeper. Eating a healthy diet that's rich in fruits, vegetables, and whole grains can help lower blood pressure by reducing inflammation and improving overall health. Regular exercise can help lower blood pressure by making your heart stronger and helping your body use blood pressure medications more effectively. Managing stress through techniques such as yoga, meditation, or deep breathing exercises can help lower blood pressure by reducing the production of hormones that constrict blood vessels. So in conclusion, amlodipine can be an effective medication for lowering blood pressure and treating angina. However, It's not right for everyone, and it's important to be aware of the potential side effects. Talk to your doctor if you have any questions or concerns about taking Amlodipine. If you'd like to learn more about how to lower blood pressure naturally, check out my video on the top 5 vitamins to lower blood pressure. And don't forget to subscribe so you don't miss any new videos. Thanks for watching. I'll see you next time.